Hi, friends. Welcome to Fresh Perspectives from AMP Recover. My name is Oliver Sharpe. Very excited to be joined by Trent Nessler, the president of Rebound Vitality. Trent, how are you today?
I'm doing fantastic, and thanks for having me on.
Well, we're very excited to talk to you today and get to know what you're up to. I looked at your LinkedIn, and it is just a mile long. Just tell me a little bit to start about yourself. What's
Sure.
your background, and what passions have really driven the arc of your career?
Absolutely. So I'm a physical therapist. I've been a sports physical therapist for 23 plus years. And very early in my career, I actually got really passionate about preventing ACL injuries in youth athletics. So it actually spawned me to go on and get my doctorate with a focus in biomechanics and motor learning, and really started to kind of dive in to see, how do we assess athletes to really kind of determine they're at risk, and then what do we do about that? So that's kind of driven me throughout my career. As I've had my jobs, that's always kind of been my side thing that I've always done, and it's led me to some really great opportunities. I was for up until recently, I was the national director for sports innovation for Select Medical, where we were taking different technologies in sports medicine and applying those clinically, and creating programs that we could use with our patients and with our athletes. And now joining Vitality, I've been able to take that over to working solely with police officers and firefighters.
Let's talk about the new job, Rebound Vitality. What's that business all about, and what's the mission?
It's a fantastic mission and vision. It was started by Luis Rivera. He's a PTATC. He started out in college and professional athletics. And then he saw this need as he was running a clinic for service personnel, for police officers and firefighters. It was taking them 3 to 4 weeks to get an appointment. It was taking them longer to get into PT after an injury. And he's like, if our professional athletes get that done in 24 hours, why don't our police officers and firefighters? And so he identified that need, and he created a system to help alleviate that, and really give our police officers and firefighters access to the top tier sports medicine physicians and really expedite that care. So the great thing is that they're able to return to the field or to out to the streets, and do what they love to do at a much faster pace and be a lot healthier with it.
Yeah, and they're frontline workers. It's a very physical job. What kind of things do you see in these first responders and kind of tactical operators? What are they dealing with? Is it overuse, wear and tear from the job? What are you finding?
It's interesting. So, when we look at the data, it's very similar to what you actually see in sports, that over 70% of their musculoskeletal injuries are really related to overuse. A lot of them are not traumatic. A lot of them are those overuse injuries. And that really has become part of the reason that we started the whole Vitality. Vitality is our injury prevention division of Rebound, where we are really trying to identify those things in the tactical athlete, both in the academy, but also in their annual physical, so that we can do things throughout the year to really try to keep them healthy. And injuries are going to occur, and what we find is that when we do this approach, when they do have those injuries, they're not to the severity that they would be before. And so that allows them to return faster, allows them to return at a higher level, and it costs a whole lot less.
And so this injury prevention, injury preparedness, and kind of overall general wellness, something we've been seeing at elite sport levels, obviously in the tactical space as well. Is this a trend you think is going to carry over to the general population? Can everyone benefit from this?
It's great that you asked that. So we developed a technology that we launched back in 2016. It's a wearable sensor technology that we originally started kind of in the sports space with that, in really trying to identify athletes who are at risk for the biomechanical factors that put them at risk for an ACL injury. We expanded that really into using that with our patients as they're going through the ACL rehabilitation, or just lower kinetic chain rehabilitation. Movement is so important. And as a therapist, ever since I graduated PT school back in 97, we've been called the movement profession, but now we actually have a way to quantify that movement. So not only being able to quantify it, but actually see, can we actually change that based on what our interventions are? So we've been using it as a part of the rehab process. And the beautiful thing now is, we've been using it in sports. We've been using it for return to play. We've been using it as a part of the rehab process, is that we're now expanding that over to our tactical athlete. And interestingly enough, we actually had started a couple of studies with the military looking at this in military personnel. And that's really what kind of spawned us moving this over to the tactical athlete.
And let's continue on that theme of technology. How has the COVID-19 pandemic over the last 6 months really necessitated a faster adoption of technology? How has that affected your practice? And just what have you seen kind of subjectively throughout the industry as far as technology adoption when previously it had been a little slow to adopt?
What I find is, and especially in rehab, I think therapists tend to be a little bit more technology adverse. I'll say to myself as a mature clinician, graduating in 97, I think my generation is probably a little bit more technology adverse versus the newer generation coming out. That being said, that COVID really pushed us into that, right? We have clinics in Birmingham, Alabama, and in Tennessee that they could not bring patients into their clinics. So they had to do a virtual interaction. And I think that's really forced people to rely on technology more. What I've seen, prior to COVID, was that technology, if leveraged correctly, allowed you to expand much greater distances than what you could as an individual. So as an individual, if I go out and work with a team, I may be limited to working with 30 folks, right? But now if I can put that same concept and those same skill sets into an app that I can distribute to thousands of folks, now I'm having a much wider impact. And before people were kind of like, well, I'm not really sure that'll work. But now post COVID, it just seems like the thing to do because now everybody's seeing that. The one thing it's been interesting for me though, that I've seen since this whole move to telehealth is that, for therapists especially, it does not replace putting my hands on somebody. I think even though we are pushed in that direction and we've kind of figured it out, I think there's still a lot of limitations of it that we need to be aware of. And more importantly, use it as a learning lesson because there may be other ways to use other technologies then that can address some of those things that we're seeing.
It's going to be interesting to see how this plays out. I think it's always going to be a hands-on profession, as you said, but definitely some opportunity to augment patient-provider relationship using the technology. I want to move on now to talk about some of your speaking engagements. You're so generous with your time and your knowledge. Why is it important for you to share what you've learned with future generations and what lessons do you try to impart on them?
I love to teach. And I was taught very early in my career that you have to give back to your profession. It was actually, the way it was explained to me is it's a part of your professional responsibility. And I do teach a lot. Post-COVID, I think I did a total of about 22 virtual courses. We did all those for free. And part of that was, there was a large double-digit percentage of athletic trainers and physical therapists who were out of jobs. And they could, you got to have CEUs in order to get your licensure. And so for me, it was just a way to give back. And the things that I'm really passionate about is ACL prevention, return to sport, BFR. And these are all really hot topics right now. So, just being afforded the opportunity to be able to share that with folks and quite honestly, give back to my profession and not have to have them pay for that. It's been really, I've enjoyed it a lot, and quite honestly, I feel like it should be the responsibility of us all. And the one thing I try to convey especially to our younger generation of physical therapists is you get done with school, man, you think you're done. You think you know it all. And the thing that I've learned over 23 years is that I still don't know it all. And I still am trying to figure stuff out. And if you look at my office, I've got books everywhere. I've got journals everywhere. So I would say to our younger generation, don't stop. Just keep on learning. And just realize that your database is 10% full. And you got another 90% to go.
All right. Well, that is sage advice there. Never stop learning. We certainly appreciate your leadership, and I appreciate your time speaking with us here today.
Thank you very much.